So, where might all this be heading? One of the things that strikes me now that I'm not working inside an individual DHB but working across the whole system is how patchy the New Zealand health system is, and it'll be exactly the same here. Performance is all over the place when you look at an individual clinician level, when you look at organisation levels, when you look at microsystem levels. And so the real question is, how do you spread innovation? And there are really only 3 to 4 DHB systems out of the 20 in New Zealand that are doing this stuff. So all is not rosy. You know, you may get a picture from New Zealand talking up the New Zealand experience that it's all fabulous. It's not. But there's been a lot of thinking about what can we do to advance innovation, and these are some lessons. Can't be engineered from the centre, and very hard to replicate what's worked in one setting into another setting. Local circumstances are a huge factor in it. This is about local leadership. This is about people stepping up and accepting the problem as theirs. It's really easy to wallow around in the problem. These are people who've got to be willing to step up to a solution. And actually, and this is exactly what Frank said, this is all about values and culture. This is not about hierarchies, it's not about policies. This is about innovation and values and culture at the local level. And this was another great quote from the conference I went to, Culture Eats Strategy for Breakfast. In other words, having a clever plan doesn't make it happen. It can just get nuked on day 2 by the culture inside the organisation. So this is about changing organisational cultures, which is phenomenally difficult. But one really practical step that the New Zealand health system has decided to adopt is moving to a different contracting approach that's based on relationships. And this is where this alliance model comes in. So after being trialled in a number of locations, in a number of micro health systems, this is now mandatory across all the DHBs, that there is an alliance relationship between the DHB and the PHO. Historically, it was a bit of a master-servant relationship because the DHBs funded primary care. This is about that funding relationship still happens, but they are now in much more of a partnership. And alliancing is a concept that's been borrowed from the construction sector. So parties getting together to take on really difficult engineering tasks, especially building motorways. And it's a way of sharing accountability and risk and targets across multiple construction parties. So the aim of this is very much integration across the system. It's about integration and coordination. They have an alliance charter that creates a we're all in one boat environment. There is one budget available for health services in our district. This is about clinically led change. It's about openness and transparency of information. And it's about a set of KPIs that we will be publicly accountable for. So the aim of this is to spread integrated care and innovation around that across the country. What are some of the key mechanisms for that? I've already touched on a number of those, and these are now being rolled out across the country. So locality planning is getting a lot of traction, locality networks and locality hubs, as I've mentioned. This notion of integrated family health centres, so rolling up general practice and primary care into more aggregated configurations that have critical mass and can develop GPs with a special interest, that can house teaching and training that visiting specialists can work from and so on. What's crippled general practice historically has been its smallness. This is a way of giving it some scale and allows multidisciplinary teamwork inside a single centre. Risk stratification I've mentioned, hospital avoidance I've mentioned. Talked a lot about Counties Manukau, as I'm sure many of you are aware. Canterbury DHB and Pegasus have done a lot of fantastic work in this space, and you'll probably know most of that through the Canterbury Pathways work is an example of this kind of activity. Different models of general practice are being looked at, and Midlands Health Network, for those of you who are interested, is a website worth having a look at, where they have attempted to fundamentally re-engineer how general practice works. They're doing that in order to try and get greater capacity into primary care. As I said, the aim is to shift a whole lot of activity out of hospital settings into primary care settings. So what Midlands Health Network has set out to do is to free up 30% of capacity inside general practice with an existing workforce and money, is to re-engineer how general practice works, to free up 30% capacity so some demand can be shifted, demand and money can be shifted into a primary care setting.